It's a tale as old as time. You're just gonna lay in bed for a little bit and look at your phone. Next thing you know, you fall asleep for a few hours, wake up, and you still have your contacts in. Okay, we're never gonna have that happen again, but then you do it the next night. And you know what happens? You sleep all through the night without taking out your contacts. Oops, what do you do? Is this okay? Let me tell you what to do if you slept in your contacts and you're not supposed to. To start, I never advise anyone to sleep in your contacts. Yes, I know some are approved to be slept in. However, statistically, you're more safe jumping out of an airplane than driving a car. But I'm not jumping out of that plane, and I don't want you sleeping in the contacts unless there's a specific medical reason for it. Now that being said, the contact lenses that we use that are replaced every 2 weeks to every month are incredibly breathable. Now this is incredibly important because when you close your eye, we do not get oxygen from the outside environment. We get it from the back side of your eyelid, and if those contact lenses are too thick or they don't transmit oxygen, your cornea is not going to get enough oxygen. It's going to suffocate, cause swelling, irritation, redness, and pain. Oh my. So let's go through a step-by-step thought process when you sleep in your contacts. First thing you do when you wake up and you realize you slept in your contacts, don't freak out. Too many times I've seen patients that know they have their contact lenses in and they start trying to rip them out and they're really dry, they're kind of stuck to the eye, and you're causing a corneal abrasion because you try to get them out as fast as you can. Give yourself a second, blink a few times, hydrate those lenses. If you have artificial tears or your contact lens solution, put it into your eye, and that's going to rehydrate the contact lens to make it easier to take off. Once the lens is hydrated, take off the lenses and put on your glasses. Yes, you need glasses even if you love your contact lenses. Cases like this, when you sleep in them, is just one of many situations where having a good, up-to-date pair of glasses is hugely beneficial. So put on those glasses. You're gonna thank me that you have that updated prescription. Let me know in the comments below how old your backup glasses are. Okay, so you've got the contact lenses out, you got your glasses on. Let's do a quick status check. Is vision blurry? Again, remember, if you have old glasses, it's gonna be blurry. But is vision abnormally blurry? Are your eyes red? Are they irritated? Are they painful and sensitive to light? Any of those is a direct call to your doctor, get in, get seen immediately. That could be the sign of a really bad eye infection that you do not want to linger. Get it taken care of right now. Now, when you do call your eye doctor, don't beat around the bush. Let them know you slept in the contacts, you need help. If they know the source of the irritation, it makes their job a ton easier to get you the best treatment and get you taken care of right away. If I hear a patient that slept in the contacts, I'm going to see them the same day. Your doctor should do the same. Now, say you wake up and you don't have any of those symptoms, what do I recommend? Well, first, I recommend you get out of your contacts, wear your glasses for at least a day or two. Artificial tears are your best friend. Lubricate, lubricate, lubricate. A lot of times, just giving your eyes a break will let them go back to where they're feeling healthy, happy, and you can resume your contact lens wear. Now, sometimes you're good when you have your contact lenses off, but you go to put them back on and your eyes will flare up again. This is a direct red flag that you have an underlying inflammation that you need to see your eye doctor for to knock it out. Once you get into your eye doctor, he's going to do a thorough evaluation, see if you have that underlying inflammation, if you have an infection, if you need an antibiotic to knock out a sight-threatening corneal ulcer. You can go blind if you get that bad of an infection. So make sure you get in and get seen. Let them develop the best plan of action for your situation. Now, the question is, how long will I have to be out of my contact lenses? Generally, if you have an infection, it's going to be about a week. But for advanced or severe cases, it could be longer or forever. So this is the biggest impetus for you to take good care of your contact lenses, replace them as prescribed, make sure you're not abusing them or sleeping them. The last thing you want to do if you love your contact lenses is be told you cannot wear them ever again. So take care of your lenses, take care of your eyes, and make sure you have that backup set of glasses. Hit that subscribe button if you find value from this, and we'll see you in the next video.